I must see my daughter graduate before I go. I feel lost. I don't know what will happen in front of me. I don't know how long I'm going to live and whether I'll be able to put through this. My name is Kee Miah Hiang. This year I'm 59. I have a daughter, a wife. We are living in a 4-room flat. During my free time, I like to go cycling. It started with a bad cough, fever, I think fever also. So I went to my company doctor. After 2 cycles of treatment, there's no result. So the doctor referred me, take an X-ray for me. From the X-ray, he discovered some white spot on my bowl of lung. So he referred me to A&E. So when I was at A&E, they do a further check. It's a cancer. Then they say better seek for a second opinion. So they recommend me some private doctor. But from there, the doctor give me a biopsy test. He say you need to further confirm where is the original of the cancer cell. Yeah, then he did a biopsy on 6 years ago. That's during my birthday, same today. That's 6 years ago. Then after the test, he confirmed it's a kidney cancer, and it's a stage 4 kidney cancer that spread to my lung. Because my kidney cancer is good, the tumor is very big. I think at the time it's about 8 cm. It's almost the whole kidney. So he said you need to take away the kidney before we can do any treatment. Since it's successfully removed, I rest for about 2 weeks. Then the doctors give me chemo, start chemo. Then from there, I have a friend during that time. Like her friends, because her husband is a doctor also. He say asked me to try whether there's a kidney specialist around. So he asked me whether I want to give a try or not. So I said no harm. So I just come to Dr. Tay. Also they refer Dr. Tay to me. So he asked me whether I want to try his method or not.
Mr. Kee first came to see me on the 19th of September 2016. When I first evaluate his condition, we look at the type of cancer that he has. He has a classical kidney cancer, but his kidney cancer was the most aggressive type. We call it grade 4 sarcomatoid, that if you don't control the disease fast enough, the disease will spread rapidly to many other organs, and he is likely to succumb to the disease. So at that point in time, I was thinking, what can I do for this poor man, who came to look for me? And at that point in time, there's only 2 drugs that's available to treat this cancer, whether it's grade 1 or grade 4. And classically, this type of grade of cancer will not survive long.
The sad part is, you know your daughter is still young, and you don't know whether you'll be able to give them support after that. I think I cannot give up like that. Because since I'm the main support in the family, I need to be strong. So I must get myself treated and recover as soon as possible, so that I can have my family can be a complete family.
So when I discussed with him, I told him at that point in time there were 2 drugs that's available for him. I did share with him that both drugs are equally effective, but both have unique side effects. We are filled with so many different and better options for patients like him. Actually, there are better targeted therapies. As a single agent, there's combinations of targeted therapy like immunotherapy.
Dr. Tay to me, is more like a friend rather than a doctor. He don't really look like a doctor. Because when he treat you the time, you don't You don't have the type of things like he will treat you very friendly, talk nicely to you, just like normal friend like that. So you don't feel tense when you come to see him. After free from cancer for about 3 years, I back to my normal life, back to work. But of course, the greatest supposed to be my wife because she's there all the while for me. My advice to the patient is, don't ever give up. Look for second opinions. Take whatever treatment you can. Thank you.
Happy birthday to Mr. Kee. Happy birthday to you.
Thank you everyone. Thank you.
长寿百岁啊！
谢谢。
耶！